People with underlying conditions, chronic pain, or disability should speak with their surgeon or a doctor before starting exercise. A person should stop exercising immediately and speak to their surgeon or doctor if exercise worsens any medical symptoms, exercise is painful, or they feel physically unable to exercise. Hello, loves. I hope you're doing well. If you've had your surgery, congratulations and welcome to the Losers Bench. If you haven't yet had your surgery and you're waiting for your date, I have my fingers crossed it'll come soon. And if you're only just starting out on this journey, good luck. Hang on, you don't need luck. You've got this. This workout is also good for people with limited mobility due to hip problems. It'll loosen up those joints a little bit. Mobility and flexibility are close cousins, but they're not the same thing. Mobility is the ability to move your joints through a specific range of motion. So it's not just about being able to bend over and touch your toes, it's about the actual joint. Mobility can benefit in terms of pain relief. It will help you improve your posture, although this workout specifically is lower body, so it's not going to do too much to your posture, except for your lower back, which will be a bit stronger. You get stronger muscles and joints. Like I said, mobility and flexibility are close cousins, they're not the same thing. But incorporating mobility and flexibility work into your training will be very beneficial. Let's start with a warm-up. We're going to march in place. You're just simply going to lift your knees as high as you can, as high as is comfortable. You're going to do this 30 seconds. Remember to breathe in through your nose and out through your mouth. The next exercise we're going to do for our warm-up is a toe touch. You're simply going to bend over at the hips and reach down as far as possible. If you can't quite touch your toes, that's not a problem. Doing these exercises frequently will help increase your mobility, which will help increase your flexibility, which in turn will help you be able to touch your toes. Let's get into the actual workout itself. The first exercise we're going to look at is straight leg raises. You're going to lie flat on your back, one knee bent, other leg straight, and you're going to lift that straight leg up into the air, bending at the hip. Keep your knee as straight as possible, whatever is most comfortable. And you're going to bring it up as high as possible as you can without pain. If you can only lift your leg a little bit off the floor, that's perfectly fine. We're going to do this for 30 seconds with each leg. Three, two, one. Very good. Let's swap legs. 30 seconds for this leg. As high as you can. Keep your leg as straight as you can. You can see my knee is slightly bent. Five, four, three, two, and one. Very good. Next exercise we're going to look at is hip circles. You're going to bring your knee up, then you're going to make circles with your hip. Going to swap legs, 30 seconds on this side. To make this exercise more difficult, you can increase the size of your circles. Try keep your bum touching the floor. Very good. Next exercise we're going to do is a 90-90 hip rotation. You're going to sit comfortably, bend your legs over so that your knees and your ankles are making 90 degrees. Then you're going to swap over to the other side, twist your torso so that you're facing to the side. We're going to do this exercise for 60 seconds so that it's basically a 30 seconds per each side. You're going to keep your knees bent at a 90-degree angle and twist to the other side. To make this exercise more difficult, you can face forward and then you'll really feel the stretch in your hip. But I would recommend starting out with twisting your whole body around. Very good. Next exercise we're going to do is the sciatic nerve floss. Sounds very fancy. It's quite simple. You're going to stand with your foot out on your heel. You're going to hinge your body at the hips. Sweep through with your arms as if you're busy pushing the air away. I'm going to do this for 30 seconds on each leg. Five, 4, 3, 2, and 1. Very good. Switch sides, foot with the heel on the ground. Push that air forward, bending at the hip, keeping your neck straight. Reach down as far as you can. You can only bend over a little bit, that's perfectly fine. Remember to breathe in through your nose, out through your mouth. Very good. The next exercise we're going to do is side leg raise. You're going to use a chair to help keep stability, or a wall or a counter, and you're going to simply lift your leg up. First doing the left leg. Reach up as far as is comfortable. You can only go up a little bit without pain. That is perfect. Don't push it past the point of pain. You're going to do this exercise 30 seconds on each leg. 3, 2, 1. Very good. Let's do the other leg. 30 seconds again. If you feel yourself going off balance a bit, you can bring your leg down and then stand flat completely with your weight across both legs, and then lift the leg again. Very good. Next exercise we're going to do is seated leg extensions. You're going to sit comfortably on a chair and you're simply just going to lift your foot up into the air. This will straighten out your leg. This exercise is particularly good for your knees. Going to do this for 30 seconds for each leg. Five, 4, 3, 2, and 1. Very good. Let's switch sides. 30 seconds for this side. If it starts feeling painful, please stop. Put your foot down flat on the ground. Give it a couple of seconds. You can try again. If it still hurts, please stop doing the exercise completely. 5, 4, 3, 2, and 1. Very good. The next exercise we're going to do is quite simple. It's an ankle circles exercise. You're going to stretch your leg out in front of you and make circles with your ankle. You're going to do it for 15 seconds in one direction, swap over, "15 seconds in the opposite direction, you're going to move on to the next foot. Same thing, doing circles. Going to do it for 15 seconds going one direction. And you're going to switch over and do it the other direction. Very good. The next exercise we're going to do is a hip flexor lunge. You're going to kneel with one foot on the ground, your other leg bent at a 90-degree angle, and you're going to push your pelvis forward. You're going to hold this stretch for 15 seconds. Switch over to the other side, 15 seconds. Remember to tilt your pelvis forward. This will help bring the joints into alignment. Very good. The next exercise we're going to do is quite difficult. If you can't do it, please don't push yourself. You're going to come into a downward dog pose. You're going to straighten out your knees, and then you're going to roll one foot from the heel to the tip of your toes, and then bring the heel back down and swap sides. I'm going to do this for 30 seconds. As I said, this is a very difficult exercise. If you can't do it, don't push it too far. You're going to do this for 30 seconds. Really stretch that leg. Very good. The last exercise we're going to do is a glute bridge. Going to lie flat on your back. Bring your hips up into the air. Don't go too far. You don't want to be resting on your neck. As you come up, you're going to squeeze your bum muscles. You're going to hold it for about 5 seconds, bring it down and up. I'm going to do this exercise for 30 seconds. 5, 4, 3, 2, and 1. Very good. Let's cool down. First cool down exercise we're going to do is a cat-cow. I don't know how yoga gets its names for its different exercises, but it is what it is. You're going to kneel down on your hands and knees, keeping your neck straight. You're going to flex your back so that it's down, and then flex it coming up. So you're going to bring your back down, lift your head slightly, and round your back, bringing your head down slightly. Repeat. stretch down, stretch up. Very good. And the very last cool down exercise we're going to do is just the march in place. And you're simply going to march in place. You can bring your knees up even higher if you like, but this is a cool down, so keep the movement to just being stretches. Five, 4, 3, 2, 1. Very good. Workout complete. Congratulations if you made it to the end. Well done. If you weren't able to do all the exercises, don't worry about it. If you keep at it, you'll eventually be able to do it. That's it from me in the Peanut Gallery. If you found this workout helpful, please like and subscribe, yada yada yada, and I will see you in the next one. Cheers!